Just last week, a South Carolina inmate was executed by firing squad for the first time nationwide since 2010. Despite death row inmate Brad Sigmund's choice to die this way, it is still a controversial method of capital punishment. We'd like to welcome Dr. Jonathan Groner, Professor Emeritus at The Ohio State University College of Medicine. Thank you for joining us.
Thanks for having me.
So the Associated Press reporter who was there to report on this particular execution describes it as a shockingly sudden and violent way to go. In fact, he mentioned that there really was no warning that shots were going to be fired, and it was almost over before it began. Why would this be a desirable option for someone who is facing the death penalty? We know from a spectator's point of view, but what about the person who's actually facing execution?
Well, I think in terms of suffering, firing squad is more likely to provide an almost immediate death. I think by the time that the condemned person has the perception of bullets actually striking him and the pain that causes, that the lights go out, because loss of consciousness occurs extremely quickly.
Mm-hmm. And there have been over 1,600 executions in the United States since 1976, but only 4 were by firing squad. So do you think that this is going to be a more widely used method?
I mean, I think it's an excellent question. I think the United States has already had somewhat ambivalent relationship towards capital punishment. I think throughout history, people have been more supportive when it was less grotesque looking. I mean, lethal injection, frankly, is supposed to look like outpatient surgery. You get the IV and you get the drugs and you're gone. It doesn't always work out that way, but firing squad is much more dramatic and makes the idea of killing someone much more present, if you know what I'm saying.
Absolutely. Well, and that's the thing, I suppose for the families who suffered their tragedy at the hands of someone who's facing the death penalty, they want to be a witness to that person getting an eye for an eye. So with lethal injection, however, it seems like drugs are harder to obtain. They have to be stored up until a certain time, they expire. And it just makes it prolongs the situation. So do you think that that is going to be the case moving forward?
Well, I mean, the real problem with injection is not just the drugs, but doing the IVs. Like, they need medical people to do that, and sometimes they're hard to come by. I don't know the answer to the question, but it's a really good test of how supportive is our country of capital punishment. I mean, right now, most people who are on death row will die of natural causes because the execution rate is far below the number of people. I once calculated at the current rate of execution, it would take like 200 years to execute everybody currently on death row. So I think we're sort of at a tipping point with capital punishment. So time will tell, and South Carolina sort of kind of really brought that issue to the fore.
Yeah, from my research, it looks like half the country is divided, half one way, half the other, as far as how we perceive capital punishment. But you say that 98% of executions are through lethal injection. Now, you've studied the death penalty for more than 25 years, and you have also met 2 Ohio death row inmates who both survived attempts of lethal injection. Can you talk a little bit about that?
Sure. One of them was a fellow named Romel Broom. I think they worked on him for about 2 hours. They stuck him over 18 times, actually met him 4 days later and photographed all his sites. And they said he was a drug abuser, but he wasn't. I mean, his veins were really fine. I just think they didn't have skilled personnel who could do the right thing. He ended up dying of COVID in Mansfield. And the other one was a guy named Alva Campbell, really terrible health, really pretty bad veins. And I mean, he had such bad emphysema that they actually gave him a special wedge pillow to lie down because they're afraid he was going to die when they were trying to kill him. And then when they couldn't kill him, they actually let him keep the pillow and take it back to his cell. He ended up dying about 3 months later, and he had emphysema and cancer and so forth. And wow. I'm not saying he didn't do bad things. I mean, he killed a police officer, but I think he sort of died by divine inspiration or whatever. I mean, he was in terrible health, and he died in his cell, and they never did get to execute him. So I'm not sure how his victims' families felt, but that's how it worked out.
Sure, sure. Um, yeah, I think a lot of people, when they seek justice, they want to see it carried out as was essentially promised when the sentences came down. But just to give people a perspective, a recent report, there's about 2,200 people facing active death sentences in the United States today. And there's roughly about 18 years of waiting for that to actually take place once you are on death row. Now, you're currently working on a book about medical ethics and capital punishment. What can you tell us about that?
Well, I mean, the inspiration for the book, actually, I testified in a capital murder case when I was a trainee, so it's kind of my first exposure. That individual was sentenced to death and also ended up dying of disease. But what I discovered in my research is the degree to which sort of the medical community has become involved, mainly because of lethal injection. I mean, there are people who've had, central lines to be executed. There are doctors who provided a lot of advice and support. And the medical community actually invented lethal injection. I mean, it wasn't some crazy far off doctor. It was a medical examiner for Oklahoma and a university anesthesiologist. And if you go back a century earlier, the electric chair had a lot of medical input. I mean, the guy who was most credited designing it, a guy named Southwick, was a dentist. And in those days, there was a lot of overlap between the dental and medical fields, and a lot of doctors helped support it. So, the thesis of the book is sort of why has the American medical establishment continued to sort of rescue capital punishment when it was becoming out of favor. And that's sort of what I'm going to talk about in the book.
Yeah, that's a very interesting perspective. Well, Dr. Groner, thank you so much for coming on with us and sharing your expertise and experience with us.
Well, thank you for having me.
We're back in 2 minutes.